Ladies and gentlemen, my name is J.R. Jordan. I'm the Senior Vice President here at Colorado Bankers Services, and I'm here today to talk to you about one of the coolest products to hit the insurance market in an extremely long time. Today we're going to talk about MyMD ASAP. The house call is back. Listen, for those of you that are sick of waiting 3 to 5 hours for a simple doctor's appointment, and yes, that's how long it takes from the time you get there, sit in a waiting room, and you got to protect yourself from catching another sickness. Then you're brought back by an assistant or an RN. Then you sit in a room and wait. Then they ask you some questions and you wait. Then the doctor comes maybe for 2 to 3 minutes. Then you wait. Then you get your discharge paperwork. Then you wait. Then you pay a copay. So if you're sick of those copays, MyMD ASAP products for you. Then you have to go drop off the script and wait. Yes, a typical doctor's office visit is 3 to 5 hours. With MyMD ASAP, it's video medicine. It's on demand. You see a doctor when you want to see a doctor from where you want to see a doctor, whether it's your couch or your home or in a hotel room, wherever it may be. Video medicine is the answer to your questions. It can do so much, it's going to blow your mind. We've all heard of telemedicine in the past. That's yesterday's news. Video medicine is the new way you're going to see your physician. Now, this product is so inexpensive. $24.95 a month for an individual, $39.95 a month for an entire family. Yes, we have brought the house call back in a 21st century kind of way. Use your smartphone, your desktop, your laptop, your tablet, Android or iPhone, and all you have to do is go to a simple URL and bam, you get to see a doctor. Look at that doctor in the eyes. They look at you in the eyes, and they're able to treat you, diagnose you, and call in a script to the pharmacy of your choice from wherever you may be. This is the coolest house call that I've ever come across. For those of you that have never received a house call or you missed the house call, this product's for you. Maybe you have kids in college and you can't get them to go to the doctor because they're always on their smartphone. MyMD ASAP. For anybody that's ever done Twitter, LinkedIn, Facebook, or Skype, you already have the know-how to use MyMD ASAP. Maybe you're a parent, you have multiple kids, and taking one kid to the doctor means you have to take all of them. MyMD ASAP. Maybe you're a corporate executive and you travel all around the country. Maybe you're a long-haul trucker and you simply just don't have time to see a doctor. MyMD ASAP. Ladies and gentlemen, there was, they say, 8 million Americans that signed up in the ACA. Well, 8 million Americans signing up in the ACA means there are a lot more people that want to see your doctor. How long is it going to take for you to actually see a doctor? There's also tens upon tens of millions of Americans that wanted nothing to do with the Affordable Care Act because maybe they didn't get a subsidy, maybe they can't afford it, maybe they don't want government-run website insurance. Well, we know what they do want. They want doctor visits. They want the ability to see a physician on their terms. MyMD ASAP. You got online face-to-face doctor visits. You got emergency helicopter ambulance. You got the enhanced benefit card, all for $24.95 a month for an individual, $39.95 for an entire family. No consultation fees. Don't break the bank, and we're bilingual. Over 60% of urgent care visits can be treated via MyMD ASAP. We can banish sick with a click. These are just some of the things that can be treated. The list is so long. Abrasions, allergies, bites and stings, contusions, cough, dehydration, earache, fever, flu, hives, insomnia, itchy eyes, lice, mild lacerations, nasal congestion, nausea, respiratory infection, sinus symptoms, skin infections, sore throat, sprains and strains, travel medications, typical UTI or typical headaches and UTIs. Ladies and gentlemen, the travel medication is huge. You forget your meds, you need a temporary refill, bam, we can do it. Telemedicine cannot. You need a new prescription, bam, we can do it. Most of the time, telemedicine can't do all the things that we can do. You know what? If you call up and you need to be seen because you got a cold, and then the physician tells you, you know what, it's fine, take this over-the-counter medication. A couple days later, it turns into something more serious and you call back. Telemedicine can't help you. We can. We can tell you and call in a script for you by one of our licensed and trained physicians. Up to $7,000 for emergency helicopter air ambulance and up to $28,000 for an entire family. It's because you don't choose whether you get helivac'd out, ladies and gentlemen. Also, the enhanced benefit card. This is actually a free benefit that anyone can get. But we've coupled it with this plan because we believe everybody needs to have it. It is that awesome. From personal experience, I've saved well over $5,500 on this card. That's enough money to pay for my critical illness, the Colorado Bankers Lifestyle Protector, my Value Benefits of America accident, and MyMD ASAP for myself and my family for years to come. On the dental savings portion, it's the Dentamax network. Over 150,000 dentists. I had to get a piece of bone implanted above in my gum in December 2012. It was going to cost $800 for that piece of bone. I pulled out my card and it cost $50. I was shocked. All I did was pull out the card. Vision and LASIK. I got Intralace bladeless, blade-free LASIK about 3 years ago. It was going to cost $3,000 an eye, $6,000. With this card, there's a number on the back you can call for vision and LASIK. It cost me $1,500. I was absolutely shocked. I told my brother about it. I mean, literally, I tell everybody about it. If you've listened to any of my calls the last couple of years, I'm always touting that one benefit because it saved me so much money. And I can see the bad shots I hit in golf now instead of having to guess how bad the shot was. X-rays and imaging, diabetic supplies, prescriptions. I got 2 monthly maintenance medications that my health insurance will cover at $15 a piece. With this card, they're $9 a piece. Lab tests, hearing, chiropractic. This is the actual letter that they receive after they sign up for the plan. And it's really cool because they get a cool membership card. It shows them how they can do it, consult a doc via webcam or phone. And webcam's built into all these smartphones and tablets and laptops, and most of the desktops have it these days. But you can use this to sell. Our exams are incredibly convenient. The majority of minor ailments that patients seek help for can be treated via phone or online by our providers without any further in-person exam required. This means you can be treated at home, from the office, or even while traveling. Have strep throat and need antibiotics? On the road and forgot your meds at home. Need a short-term refill on your blood pressure medication? Whatever the case, should you require a prescription, it'll be electronically routed through MyMD ASAP to the pharmacy of your choice. And we want you to have personalized URLs that you can send to potential clients and put on your websites that are automatically coded to the business that you write. Effective date on this plan is the 1st of each month for individual and list bill. The draft date is the 16th of the month. If there's changes or cancellations, got to put it in writing.